Okay. Well, good morning and good afternoon, everyone. I'm seeing these numbers climb, and that is very exciting. And more exciting is that we have Patrick Casal here with us today. Um, we'll give everyone a minute to join us. And in that minute, why don't you tell us where you're calling in from? You can use the Q&A to drop that in. And then we'll just
looking forward to seeing where people are coming in from and watching from today. I'm in Asheville, North Carolina. So Houston, Texas, St. Augustine, Michigan, Oregon, Tampa, New York, Colchester, Connecticut, Minnesota, Phoenix. Finally not as hot. Okay, all over the place. Awesome. I love it. This is really cool. I always like to see where people are watching from, and I appreciate y'all making the time to be here today. Chicago, Connecticut, Georgia, Los Angeles, Raleigh. Okay. Greensboro.
love
Very
it.
cool.
All over the place. Fun. Well, it's 11:02, so I'm thinking we will just get ourselves started. The good news is it is being recorded. So if you have to jump off, or if you join late, or if you feel like you want to revisit something, I will be sending the link out after this event so that you can go back and watch it on your own time. So then just a couple of quick housekeeping items. If you do have any questions, please drop them into the Q&A. We can answer them as we go, and we also save time at the end for questions. Trying to think if there was anything else. I'm Carrie. I work at Spruce Health. We have Patrick with us today, and we'll be introing him in a second. But with that, I'm gonna get us going. So we have an exciting agenda. We're going to quickly touch on what Spruce is for those of you who are new to us. We're going to talk about Patrick and all that he's involved in, and then we'll get into the meat of the discussion with knowing when to hire and scale, navigating employment models, attracting ideal employees, digging into retention strategies, touching on the criticality of developing a culture in a telehealth world and how to do that, and how to create a neurodivergent affirmative environment. So a lot of territory to cover, but we're gonna do it, and we're excited to do it. And please do ask your questions, because it's exciting to have Patrick with us, and it's our time to really tap his brain. So don't hold back. With that, what is Spruce? In a nutshell, for those of you who are not already familiar with Spruce, Spruce is a communication platform, and it's been designed for all of you on this call today. And it is designed with easy HIPAA compliance in mind, which is nice. So it's something you don't have to even worry about. It pulls all of the communication channels in together, which would be your business phone, your fax, your text, your video, into one cloud-based solution. We've had folks say it's like having their office in their pocket. It's incredibly easy to use, and you can do that on your phone. You can do it on your computer. This illustration is mainly meant to show you all that you can do using the Spruce app. And we're here to answer questions if you have them, but more importantly, we're here to get the most out of Patrick. So next up is, let's meet this man. Patrick, I'm gonna let you intro yourself, because I know you can do that best.
Yeah, thanks, Carrie. So for those of you who don't know me, I did have major throat surgery last October, and I had a vocal cord damaged. So my voice will go in and out as we speak today. That's why I always encourage questions, because it helps break up the constant talking that puts a lot of strain on my vocal cords. So I love engagement. If you've ever come to any of my webinars before with Spruce or elsewhere, or you listen to my podcast, engagement is really important. So I want to answer your questions more importantly than getting to the content, if that is what happens. So my name is Patrick Casal. I live in Asheville, North Carolina. I am a group practice owner here for Resilient Mind Counseling, and I also am the owner of All Things Private Practice. All Things Private Practice is a coaching and consulting business for mental health entrepreneurs who are looking to grow, scale, stabilize, and strategize outside of the therapy room, or grow their businesses. I have helped thousands of therapists, both from coaching programs, retreats that I host all over the world, my podcast, and my Facebook group, All Things Private Practice. So really happy to be here and have this conversation about group practice ownership and leadership.
Awesome. Thank you, Patrick. And also, sorry about that surgery. I know you mentioned it to me just before we jumped on today, and that sounds harrowing to say the least. So I'll be sure to try and jump in and fill in some good holes if need be.
Cool. All right, let's jump into it.
Yeah. Okay. So 6 simple strategies to scale your practice. I am here for it.
Okay, so a lot of you who are here, if you're looking to scale and you're looking to start a group practice, you're probably starting to think about how do I start spending less time doing one-on-one therapy? How do I start like making more money in my business? And a lot of you are probably thinking about opening or starting or scaling a group practice. I get this question a lot where people will ask me, hey, I want to do coaching and I want to start a group practice. And my first question is always why? What is your why? What is the reason? And if you are thinking about starting a group practice or you have just started one, put that in the Q&A as well, your status and your situation and what you'd like to achieve and your reason. I really want to know the why. Because if you simply want to refer in instead of out, I always suggest that that's not necessarily the best time to scale or to start a group practice. If you want to be a leader, a mentor, a guide, a coach, a boss, a CEO, you want to handle the administrative side, the operational side, the development for clinicians in your community, and you want to help more people within your community, that's when we can really start talking about this because I think there is a misconception that you are going to start a group practice and all of a sudden you are going to just be making money hand over foot. And that is just not the reality. Most group practice owners I know are hardly breaking even. They're not making profit. They're not paying themselves. And they are staying up at night, kept up by feelings of fear and anxiety and stress about how do I fill my clinicians' caseloads? How do I ensure that everyone's paid? How do I make sure I can give them the most benefit and ensure that they have a good place to work? Now, don't get me wrong, there are definitely bad group practices out there too. But the reality is that for the majority, it's really important to start thinking about that. So I always circle back to this because this is a thing that we can circle back to in terms of our values for our mission statement, for the way that we hire, for the way that we are showing up, because ultimately this guides everything. So when it's time to hire and scale based on a couple of different factors. Number one is like, okay, we're busy, right? Like my practice was so busy during COVID in 2020. And I did initially have I'd rather refer in instead of out. I've also been a leader or a boss or a mentor in every single place of employment, my soccer teams, every place I've ever been in life. It just comes very naturally to me. And I started to realize that as a private practice coach and strategist, I could start kind of working as a mentor, ensuring that people were having very different experiences than what I had going out of grad school, where I went into community mental health. I was stressed out all the time. I was working in a crisis unit in middle management. I was probably putting in like 70-hour weeks. It was awful. And when I finally started my private practice, I was like, okay, this is the finish line. A couple of years in, I fine tuned things. Things are going really well. They're optimized. I'm busy all the time. And then I start to think about diversifying my income. I'm an autistic ADHD entrepreneur, so I do not sit still well. I have a lot of ideas. I have a lot of creativity. Monotony and doing the same thing over and over and over again doesn't sound like an ideal day to me, or a week, or a career path. So I started thinking about other things that I could be doing. And it's really important to start thinking that way and strategizing. So you want to be setting clear goals and financial planning. Number one, look at your numbers, look at your profit. If your private practice is making money, that's a good indication that you can hire somebody, that you can bring people on. Because if you're bringing people on while you're breaking even or you're, losing money, hiring is expensive, onboarding is expensive, training is expensive, the marketing that goes into it is expensive, development is expensive, and hell, turnover is expensive. So, if you are not making a profit in your private practice, in your solo practice, I do not advise starting a group practice. I want you to make sure that you have profitability, that you have referral streams coming in, that you have consistent calls and inquiries, because you're going to need to help your employees or your staff get off the ground running. So this kind of brings us to our next slide, which I think is potentially about 1099 versus employee W-2 status. This is a big question, and I am not a tax professional. I am not a lawyer. I do not work in most of your states. So you all have to kind of pay attention to your state laws. A lot of people start with 1099s or contractors because it's a lot easier to get up and going. There's a lot less resource going in. You basically provide, the platform, maybe a web presence, and that's about it. Your contractors would be paying the remainder. They pay all their expenses. They pay for their Spruce Health membership, their Hushmail, their electronic medical record system, whatever they're using. They pay for their office space. If you find yourself dipping your toe into paying for those things, you're getting dangerously close to employee status, and the IRS will happily take that money back from you if they ever discover that. So you have to protect yourself. I always say if you want to do contract model, 1099 model, you don't really get to have a say or any sort of control over the vision of your business. It's more like an Uber driver showing up to work or someone who just clocks in and out. They get to make their hours. They have autonomy over everything and anything, all the decisions of the hours they want to work, when they want to take time off, etc. You really do not get to have a say in how the work is done. The W-2 model, in my opinion, is a much more sustainable model, both for the employees and for the employer. The W-2 model is going to cost more upfront. I started with 1099s, and I made a massive transition in 2023 to transition 20 therapists to W-2. Now, what I would say is that the W-2 model is definitely more expensive for the employer. So I would start with one employee, not two, not three, not four, unless you have a significant amount of profit. You're going to be taking over the employment taxes, the payroll taxes, the malpractice insurance, the Hushmail, the Spruce, the EHR, the marketing, everything. You're going to take care of all of that as the employer. And that's important because there is a lot of expense that goes into having a W-2 employee. You also want to figure out labor laws in your state for part and full-time staff. So really getting a good understanding of how to break that up and how to create the cost calculation and analysis to ensure that you can afford to do this. So our W-2 employees right now, we have full-time opportunities for 24 clients a week, part-time at 18 a week. All of our full-timers start with 4 weeks of paid time off, medical and health stipends, sick time, $500 CEU stipends, in-house supervision, in-house case consultation. They also have team retreats, quarterly bonuses, etc. Our group practice prioritizes people over profit. However, we take a significant hit on the tax implication side because we're paying all of the expenses. Now, we are growing rapidly. I get a lot of people who ask me, where do you hire? How do you create job postings? Nobody wants to work. I hear all of those things all the time. None of those things are true. It's really about getting clear about who you are trying to hire. You really want to figure out how to transparently state and define your job expectations and roles and what is offered and what you're looking for. You almost want your employees to interview you the same way that you're interviewing them. A good fit is valuable. A bad fit will cost you money. Whether it's on your side or the other side, turnover costs money. We've been a group practice now for almost 3 years. We've had 2 clinicians leave in a total of 3 years in a career path that is often bogged down by burnout and unsustainable. That is, again, because we value the employee. We make sure that we are transparent about our numbers, where the money is going, what we're investing the money into, how to ensure that people feel like they are appreciated, not taken for granted, that their ideas are heard, that they feel seen, heard, understood, and validated. And if they want to move into leadership tracks, we support that and encourage that as well. This is really important because your leadership team is going to come from the people that you begin to interview at first. You're going to start to notice folks who are just really doing a great job. Maybe they're great leaders. Maybe they're great administratively. And that's when you can start to really grow your business, because they're going to take things off of your plate that you're doing. Because at first, you're probably going to be doing almost all of this. It's really, really important to have good team members in place. That means schedulers, admin support staff, clinical team leads, office managers, insurance billers, etc. We have people in all of these roles because we only want our clinicians to show up, see clients, do notes. That's it. I do not want them to have to worry about all the extracurricular activities that bog them down and don't make them feel good about the job that they're doing. So I know we have some questions, and I want to kind of look at those first to see if there's anything I can answer.
Yeah. Well, and so Nicholas has a question about your pay structure for your W-2 employees. And of course, I had a couple of things percolating in my mind too. I have so many questions as you were talking, but it's probably because I'm not in the space. So I have some naivete on that. But let's start with pay structure. How did you determine that?
We had to calculate all the costs. That's where you start with pay structure. You don't just choose a number and throw it against the wall. You have to calculate all of the expenses of having an employee. This means all of the benefits that you pay for on a monthly and annual basis, the payroll taxes, etc., the marketing costs, the SEO costs, the office administrator costs, building all of that in to figure out how much it's going to cost you per employee. So once you're able to do that, you can then start to plug in your average rate of reimbursement. Whether you're a private pay practice or insurance practice, you know the average rate of reimbursement. That's really what gives you that indication in terms of how many hours do I need people to work and at what cost can I pay them, where I'm still making X amount of money, but paying them well. And we pay people significantly more than the local group practices in my city. So if, for example, I see people sometimes paying their clinicians $30 an hour, that doesn't seem worth it to me. I would not do this job for $30 an hour. So we had to make this attractive, which means that we have to take less profit. So there's that balance where you have to be able to really understand the numbers. You have to sit down with your accountant. You have to sit down with someone who can really explain line item by line item, because a lot of us as therapists are not great with the business side of things. We often struggle when we start to see the money, we start to look at it, it starts to become paralyzing. You have to have a good team in place. That way you can kind of look over every single line item. Okay, if I'm going to offer a CEU stipend, what does that cost me per month per clinician? Office space, health stipends, PTO, etc. Everything has to be broken down. Once you have that total cost compared to your average rate of reimbursement, you can then determine your pay rates. And if it feels really low, it's a time to start thinking about, are we going to have to remove some of the benefits at first and introduce them as we go, as we grow? Is there other ways we can increase our revenue? Maybe we can offer groups. Maybe we can offer trainings for the community. There are lots of ways to increase your bottom line and also pay your folks more money.
Yeah, that's interesting, because I was thinking that as you were saying all of that, if you can only pay X, like say it's that $30 an hour, but the rate in your community has to be 50, then you can't obviously find folks who are going to want to work for you. So it's figuring out how to, I guess, make it all work. Carolyn had a question, and she's asking, well, first she's saying that she's interested in having a small practice with 2 to 3 clinicians at most. And she's wondering, would you recommend 1099 or W-2 for a small practice like that?
So I don't think the size of the practice matters in terms of 1099 versus W-2. It always comes back to, what are you wanting your vision to be? If you want to have control over your business, W-2 is absolutely the way to go. You're protecting your staff, you're protecting yourself. 1099, there are so many ways to slip up and accidentally cross over that line where the IRS can say that you are treating your staff, your 1099s, like employees. If that does happen, they will recoup that money and they will fine you. It happens all the time. So I always recommend going the W-2 model. It's going to cost you more upfront. It's going to give you a lot more peace of mind and security in the long run. Your staff are also going to be, there's going to be more longevity because they're going to be able to have security with payroll and W-2s and being able to accumulate a work history for loans and for mortgages and all of the things that you cannot really do with a 1099 position.
Hmm. Well, so then following up with that, thank you for that. So he, for everyone listening in, W-2 sounds like the way to go. But Sabrina's wondering, how do you raise money for W-2 employees without taking on contractors other than curriculums?
You know, it depends. Honestly, it depends on your niche. It depends on the amount of client calls that are coming in. This is why you can always start with a part-time W-2 employee. You don't have to start with full-timers with benefits, but you can start part-time and then you can raise money and start to reinvest into not only your business but your staff as well. And there are lots of ways to do that, but it's not a significant difference. If you are going to do a 70-30 split 1099 and instead do a 60-40 split more or less for W-2, it's about the same. And you're basically taking on the cost of the taxes and the expenses. And again, those are now taxes that you are paying as the employer, which are then tax deductible for yourself. So there's a lot of misconception when we're thinking like 1099 is just easy, it's cut and dry. It is not. It's an easy way to get started, but it's also an easy way for you to get down and dig yourself a hole that you cannot get out of as you grow.
Interesting. If I may ask, is that how you decided to do that major migration from 1099 to W-2? Did you feel like you had to, or was that something you'd always planned on?
It was something I always planned on. So I wanted to ensure that we could offer benefits. I wanted to offer CEU stipends, health insurance, PTO. We can't do that as a 1099 employee. There's
Mhm.
not a lot of loyalty from a 1099 for a group practice if they're not receiving anything in return.
Mhm.
So there's a lot more turnover within the 1099 model. And
Mhm.
turnover is expensive because onboarding is expensive. And in the long run, a W 2 provides stability and security. So that means that, the employees' taxes are taken care of, their malpractice, all their expenses. They
Mhm.
feel secure within working for the group practice. They know that they have a safety net in a way. And it makes things run a lot smoother. So it is more expensive, again, on the front end. In the long run, it is going to save you money and a headache every single time.
Yeah, it sounds like it. Then, of course, one follow-on question from me. You were able to accomplish this within 3 years. Is that typical? Because that sounds pretty aggressive to me.
I think that if I didn't have all things private practice, the group practice that I run would be differently structured. So I always like to be really transparent about that. I have a secondary source of income. My coaching business probably um, creates more revenue than most other people's businesses. So it's a lot easier for me to say I'm not going to take as much profit in the group practice that I run. However, with the clients that I work with for coaching, starting off with W-2, you just grow in a different way. And you can grow still pretty quickly as a W-2 model. You just want to onboard and hire less impulsively. You want to do it very strategically. You want to do it intentionally. You want to make sure maybe two at a time. And then you get them full and then you hire two more and you leave it like that. With a 1099, you can honestly hire 10 people at once. It doesn't really make a difference. So I
Mhm.
would just be very strategic and intentional about how you're creating an employee based practice.
Okay, love it. Are you okay with me continuing to go through some of the questions? Because this is obviously a hot topic. I think everyone's very interested in this one. So is it okay to keep going, or do you want me to table some of it?
Yeah, let's do a couple more and then we'll keep going just because this is a complicated topic that we could spend hours on talking about.
Yeah, I
So I'm happy to answer another couple, but I do think we'll move on after that just to make sure we
okay.
get through everything.
For sure, for sure. And some of these can be probably quick ones too.
Sure.
Do you pay per session or a percentage?
We pay per session. So we pay a combination of a clinical flat rate that everyone gets and then an admin rate. So we built in an admin rate as well for note taking, case consultation, team meetings, networking, etc. Everyone at my practice gets 5 hours of admin hours a week, regardless of whether they use that or not. If you fly through your notes and you're just really good at time management, well, that's great. If you need the whole 5 hours, that's okay too. So my vision has always been that the better we treat people, the easier we make their jobs, the longer they're going to stick around. And that has proven to be true. So, in an era where people are really struggling for resumes and applicants, we just got done with 55 resumes in the last 2.5 weeks. We did not interview all 55 people because I don't have the time. But my clinical team did interview at least 25 of those 55 people for the right fit, and we hired three of them. But we're very intentional about that. So I think this just goes to show that the better you treat your employees, the better your reputation as a group practice becomes, the more longevity you create, the less turnover, and the more profit that goes around to everybody involved.
Excellent. And forgive me if you've already sort of built this into one of your answers, but do you pay a flat salary or is it commission based?
So everyone gets a flat clinical hourly rate plus the admin rate. We do have some folks who are salaried. Our clinical directors, we have three of them: an LCSW, LMFT, and LCMHC supervisor. So they all are all salaried. Our office manager is salaried. Everyone else gets a flat clinical hourly rate. They do get paid for no shows. So we build that in as well. We I've tried to take the group practice model and kind of flip it on its head, which is what I've tried to do with everything I've ever created, which is like, why do we have to do things one way? When in reality, if we do things a little bit outside of the box, the results are significantly better. So ultimately trying to ensure that it just feels like a place that people want to work. And as a private practice coach, I'm like, why are people working for me when they could go, I help people start their businesses every day?
Mhm.
Um, and I think that's a question that gets commonly asked. And the answers are like teamwork, camaraderie, connections, admin support. I don't want to handle the business side. I don't want to deal with the marketing side, all of those things. So there are lots of reasons people want to work at group practices. You just have to make the group practice attractive in terms of what you've created and what you offer.
Okay. Okay. Interesting. Um, this one is a smidge off topic. It's more about your client acquisition cost. Do you want me to table that one? It's interesting, and I know you and I have talked about this in other webinars because you're very active on social media. I don't know if you do much paid advertising, SEO or PPC or any of that. But Anthony's saying that he's got a CPA of about 150 per client. Is that something that you think about, that you track, that you're actively involved in, or not so much?
Yeah, we definitely think about cost per acquisition and cost per client inquiry. We do run Google ads. We do have really good SEO in place, and it pays for itself. So I would say turn on, if you have a good Google Ads specialist who you really like, turn on the tap, so to speak, up the budget when you're hiring and bringing people on so that you can fill caseloads quicker. We've had to decide like how much does it cost us to fill a caseload? Right now we're averaging about 36 calls per week for each clinician that we bring on. So we are able to fill caseloads in about 2 weeks, which is also quite attractive for people. But once we are done hiring, we will turn the Google ads way, way down and we will just kind of let them trickle because we don't want to completely shut them off, but we do want to ensure that, there's still some presence. We just don't need to be investing in it all the time.
Okay, great. One thing which I'll just let you think on, you don't necessarily have to answer right now, but we've had a couple folks asking if you have a list by chance of essential costs that one should think about when they're thinking about switching to W-2. I know you've got a ton of great resources on your website. Is that something you may have already compiled, or do you have like top of mind, think about this?
Yeah, I don't have a resource for that as of right now. I always point people to Maureen's group practice exchange membership site because honestly, Maureen Warbach is a good friend of mine. She's a well-known commodity in the group practice world. She has all of that stuff. I don't need to recreate the wheel.
Mhm.
Um, Everything I used to get started probably came from her membership site. So I always just point people there. Eventually, I will create guides and resources for that, but I do not have one at this point in time.
Okay, great. Well, hopefully everyone got that. Say it one more time. Maureen's.
Yep, it's just called the Group Practice Exchange.
Perfect. The group practice exchange. Awesome. All right. Well, I'm going to keep us going. Thank you for that.
And I want to just acknowledge like 1099 versus W 2 is a conversation you should have with your accountant. It's a conversation you should have with your business attorney. Like, Really get clear on your contracts, really get clear on your state's requirements because they're all different. And I cannot give unilateral, like black and white advice there. So that's always my first piece of advice when we're talking about that topic.
Perfect. Thank you for that. So we are on to employee retention strategies, which I imagine is also going to be a hot topic.
Yeah. So these are the things that we are building into our job postings and openings because if you're saying I can't attract the right employees, nobody's applying for these job postings that I'm making on Indeed or in local therapist Facebook groups. Take a look at your job posting. Take a look at what you're offering. Are you being clear about the benefits, the rewards? Are you posting the pay? Or are you just saying like depends on experience? We are getting away from that model where people are probably not going to apply for your job if you don't post the pay. So being transparent about the money stuff is really important. I'm happy to share my job posting in the chat as well so that everyone has it, or give it to Carrie and she can send it out when we send the recording out. But you really want to get really clear on the benefits that are being offered. So I also think it's really important to poll your staff, to have difficult conversations internally, to ask them for feedback. We do a lot of internal polling and conversation around what do we want to see implemented going forward? What do we want to see in 2024? If we had our dream scenario, what benefits will we love to see included? So, ways that I've kind of creatively created employee retention strategies, CEU stipends, 401ks with 4% matches right now. We do a mental health and health insurance stipend per month. We have the in-house supervision. We have team meetings on a monthly basis. We have team retreats on an annual basis where everyone comes together from all parts of the country and just hangs out, celebrates all the good work that we're doing. Every single one of my clinicians gets free access into all of the courses that I host. So if they want to participate, they get to show up. We try really hard to encourage them to do things differently. If they have interests outside of the therapy space, if they want to host retreats or coaching programs or courses or podcasts, I encourage all of it because monotony is a killer in this profession. And doing the same thing over and over and over again, 60-minute increment of time for service over and over, we know that's a recipe for burnout. We ensure, we do not just suggest, but we ensure and require that people work 4-day work weeks. We do not allow people to see clients 5 days a week. We absolutely advocate for self-care. We are not one of those businesses that's like, hey, we practice what we preach and we love self-care, but then we don't actually encourage you to participate in the things that help you rejuvenate yourself and recharge yourself. So, because we're neurodivergent affirming, I want to ensure that our clinicians are working the hours that make sense for their systems. I'm not a morning person. I would never start work before 10 a.m. I like to work later into the evening because that just works better for the way my brain works and when it turns on. So I don't care if my clinicians want to work 8 p.m. to 2 a.m. It does not matter to me. So giving some autonomy is really important for client or employee retention. This also means that during your interviews, asking about what they want to do, if they want to be a part of a leadership team eventually, would they like to do trainings? Would they like to really getting a sense of what else they would like to do and then encouraging them to pursue those things or supporting them to pursue those things. I think we so often think if we do this, people are going to pursue this stuff and they're going to leave. But in reality, they're just going to add that into their day or to their week or to their month. And we all need goals that we're looking forward to and moving towards. So really trying hard to prioritize self-care. Make sure people take time off if you're offering time off policies. Don't allow them to email, text, call, etc. when they step away from the job. This job is too hard to be engulfed in and wrapped up in all the time. And I'm sure a lot of you are guilty of overworking yourselves, as I am as well. So just really trying to ensure that we are doing that. And then professional development. What kind of trainers do we want to bring in? Who's our niche audience? Maybe we'll get some consultants and trainers from those populations. So for us, our client target pop is the neurodivergent, LGBTQIA plus, and the BIPOC communities. We bring in trainers from those communities. We do that on a quarterly basis. We want to ensure we have as much personal and professional development as possible. We do virtual game nights because people are all over the country. We have a lot of connection and camaraderie, and we are a completely virtual practice. And we don't see each other's faces on a daily basis, but there is a lot of support. There's a lot of referrals. There's a lot of consultation going on all the time. And that is one of our slides, I think, which is how to create a telehealth culture. But ultimately, these are the ways to really ensure that your place of business feels like a great place to work. Because if you're making an employment ad, there is competition. There are other people who are also hiring clinicians. So it's not always about the bottom line dollar wise. It's sometimes about like, what else can we do to ensure that personal and professional development is going on? I do one-on-one check-ins quarterly. We offer 20% quarterly bonuses based on the profit that each clinician brought in. And I sit with them. We go over caseload. We go over any other things that are going on behind the scenes that they want support with. And then we do the bonus check conversation. I want them to feel like they have investment in what we're doing. That's why we're also going to be implementing profit sharing in the next year. So, like, we really want this to be a place that just does things differently. Some people get in with tuition reimbursement. Some people who specialize in either rural communities and mental health or substance use, et cetera, can get in to offer tuition reimbursement if someone spends 2 to 3 years at your practice. There are lots of ways to have employee retention, and it does not always have to be what you can pay someone per hour.
Nice. Nicholas just asked a question. So given that your staff, that all of you are remote, do all of your clinicians see folks virtually, in person, or is there a hybrid approach? And do you have a recommendation on what has worked best?
Yeah, so we have a hybrid approach. I just put my employment ad in the chat if anyone needs it.
Okay.
We have a hybrid approach. We do have a 2-office suite here in Asheville. However, we have 20 therapists and only 7 of them live in Asheville. So the ones who do not live in Asheville are 100% telehealth. The ones who do live here in town have the option to have a day and a half in the office. Some of them take it, some of them do not. I think it just depends. Sorry. I think it just depends on your niche, on your target audience. So for us, telehealth has never been a problem. Honestly, I didn't have a problem bringing my entire private practice to telehealth when COVID was first starting. A lot of people kind of did. I've never had that issue, but we also market our practice as a telehealth practice. We don't market our practice as an in-person provider. So we have services pages on our website that say online therapy, and we have different cities in North Carolina that we have pages associated for. We run Google ads for that specific page and service type, and online therapy is all over our practice. So it's not like it's a surprise when a client calls and we're like, oh, we only do telehealth. We're very transparent. If people call and they want in person and we don't have availability, we just refer them out. I don't know if that answers that question, but I think it really depends on your niche and your preferences and how you market yourself.
Yeah, for sure. Someone has raised their hand, but I don't know that I can unmute you. So perhaps drop your question into the Q&A and I'll make sure. Oh, okay, Easley. So Easley did ask, thank you for dropping in your job rec into the chat. Easley has also asked if you could provide an example of a staff survey you've sent out. I don't know if that's like at your fingertips or if you have.
That's not at my fingertips, but you can really make easy surveys.
Yeah.
You know, you can make a Google form pretty easily and you can send that out to your folks and you can make them anonymous. You know, if you want anonymous feedback, because maybe people will feel safer to leave their feedback anonymously. So we always ask for what can we improve? What can we do different? What would you like to see? What areas of growth? Do you have any interest in upcoming opportunities? So we're an MBCC provider too. So we offer in-house trainings. We want to ensure if people want to offer those, I teach them how to do those things as well. but I do not have that form available to me right now.
Got it. And Patrick, actually, a couple of people just pointed out to me that because chat is disabled for our audience, they can't see that job posting. So what you can do is either drop it into Q&A, but then I will also include it in the email that I send out to all of you after this. So you'll get it.
Sounds good.
Yeah,
I don't
that
see a way for me to drop anything into Q&A, but yeah, if you want to send it out to everyone, then it'll be in the
I will
email.
do that. Yep. So all you folks, stay tuned. That'll be coming at you in a couple of hours. Okay, good. For the sake of keeping us going,
Yep.
I'll keep us going. We do have more questions, but we'll save them. Yes.
Yeah, let's save questions for the rest of the time until the end, and we'll get through these slides.
Okay. Okay. Perfect.
It's obviously a topic that y'all want to talk about.
Yeah, there's so many. I even have so many questions I'm holding back on.
So I think that this slide kind of goes into this what we just talked about, but attracting your ideal employee or attracting the ideal employees goes into your job ad, it goes into your marketing, it goes into your mission statement, it goes into the content and copy on your group practice website. So again, having a culture that you are developing, that you're creating, and then attracting the right candidates, being really explicit about who you want to hire, what you want them to specialize in, who your target pop or niche is, what your values are as a practice, and really making sure that you're interviewing the right people. I think we can skip through that.
Okay. Though there is one question that I was going to bring up as well, and it has to do with if you have your clinicians that are based outside of North Carolina, how do you go about marketing and taking on clients and such out of state? Is there a quick way to sort of summarize how that all works?
Yeah, so all of our folks who live outside of North Carolina are licensed in North Carolina. So we're not seeing people from other states. Maybe once the counseling compact really goes into effect, we'll start seeing people in the states that are in adjacent to that. But as of right now, all of our folks used to probably live in Asheville or live in some part of North Carolina, got licensed here, and then moved elsewhere. All we ask is that we keep track of their CEU requirements, talk to your CPA, because if you have staff in other states, you are going to have to pay state taxes in a lot of those states and payroll taxes. So that is something that is a cost. I can't lie about that, but ultimately talk to your accountants about that stuff too.
Okay, perfect. Creating a thriving culture. It sounds like you've done an excellent job of this, as you touched on it a little earlier, but I'm excited because I think I could even use a little more of that.
Yeah, it's something I've taken pride in, and I've put a lot of effort and energy and intention to. So being able to really offer your okay, so in Spruce Health, I'll just give Spruce a little nod on this because we use it for this reason. We have a team social thread and a team clinical thread. The team clinical thread is like, hey, I need clinical consult on this topic. Does anyone have a referral source for A, B, and C? Does anyone have an opening for a client who wants to work with A, B, and C? Great. That's what that is for. We keep it very black and white. Our social thread is more like game night, pet photos, what did everyone do this weekend? What's everyone reading? What's everyone watching? Stuff like that. We engage constantly in there because we don't have a physical location where we can all spend time. When I'm interviewing people, I'm asking them about the importance of team and camaraderie and connection. If they're like, oh, I'm a loner, I don't really like to be a part of a team, well, you're probably not going to be a good fit into what we're trying to do. But if someone's like, I really need that, I want that, I need to be a part of it, I want to have the connection, the communication, the accountability, it's probably more likely that they are going to be a good fit for the practice culture. Now, we have monthly team meetings, weekly case consultations that are alternating between our clinical directors. We have monthly virtual game nights. We do in-person events for the people who live in Asheville, and then people have driven all the way from Chicago and Indiana for those. We've done holiday dinners. We've done team retreats in Charleston and Asheville. So we have lots of opportunities to be involved, to be connected. If I notice someone just really hasn't been present lately or participating or showing up in any of these ways, I'll just check in on them one-on-one. And I think we so often avoid one-on-one check-ins, and because we're fearful of what the responses are going to be. But I always try to take the approach of just checking in and seeing if they're okay, if they need support with anything. I've noticed you've been quiet lately. Haven't seen any of the chats or meetings. Just want to make sure you're okay if you have everything what you need. So little gestures can go a long way. Um, all of my clinicians get to come on my retreats. I offer one spot per retreat for the events that I'm doing. So I just had some come to Portugal. We had some come to Ireland, some come to Spain last year, trying really hard to help them also step out of their comfort zones, acknowledging that there are so many things in this profession that we can do. So I think it would be quite hypocritical of me to go out there and say, I've got this thriving coaching business. I have a podcast that's sponsored and monetized. I do retreats. I have coaching programs, all the things. Yet I'm not going to help you or show you how to do all the things. So that's a conversation that we have during interviews, because a lot of folks who are interviewing are like, I listen to your podcast. I am in your Facebook group, blah, 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 blah. Okay. Well, if you have an idea of who I am, I can't say like, okay, now if you want to pursue any of these ventures, that feels off limits to me. So I really want to ensure that we are mentors and guides for them, opposed to feeling like bosses. I really just want them to feel like they are at a place that supports their vision and goals. I cannot, as an employer, expect that people will show up, work for me for today until the end of their career. That feels really unrealistic. So the better we can be transparent and have communication about this stuff, the more it ensures that things are really optimized and feeling like a well-oiled machine where everyone is in board with the mission of what you're trying to do.
I love it. I love it. Thank you. And then this one is also very eye-opening.
And I
Creating
think we could have a
neurodivergent
whole
environment.
webinar about this. Okay, so we have 13 minutes left, and I want to know, should we run through this quickly? Should we do questions? Because
Yeah.
I, this is a topic that I have an entire podcast on,
Right.
um,
Right.
and something that is a big topic.
Let's see. Okay, folks. In the Q&A, quickly weigh in. Do you want Patrick to delve into this, or should we go back to questions? I wish we had more time. I know, me too. I'd like to get to
My
the rest.
voice doesn't, but my energy does.
Questions, please. Questions.
Okay.
Delve
We'll
and
go
link.
with questions. I'm happy to come back on here and do an entire segment on neurodivergent affirmative group practice ownership.
Okay.
Also, if y'all are interested and you don't know, I do have a podcast called Divergent Conversations, which I co-host with Dr. Megan Neff, and we talk all about neurodivergent affirmative practices. We talk all about our own autistic ADHD life experiences. We talk about it from personal and clinical perspectives. So that is a good resource for now, I think.
Yeah, and maybe what I can do, Patrick, is in that email. Yeah, Christina's saying, what's that podcast again? I can link out to the podcast and any just really good resources that may answer some questions for folks.
I will email you now, Carrie, and just send you links so I don't forget, because I otherwise will forget for sure.
Okay, good, good, good. That'll be perfect, because then I'm going to send this all out. And I know too, when I've gone on your website, you've got so much good stuff on this subject. So for all of you that really want to dig in, it's all there. And as Patrick said, it's something he's really passionate about. Oh, look,
Please use my
Julia.
job posting for whatever you want. Like, take it, make it your own. I do not care.
Nice. I love it. Julia, by the way, just said that you helped change her life, starting her practice. So that's really nice. And we have someone with ADHD on who says they're looking forward to listening to your podcast. So a lot of good stuff there. But yes, why don't we, oops, why did it go backwards? There we go. Let's get to answering a few more of those questions. Because I know that it's very rare for us to have this kind of time with you. So here's one. Would there be a benefit to doing a therapy collective instead of having one person incurring all of the costs?
Yeah, I think there's a benefit to that. I would just be careful. You know, if you're going to go into partnership, you almost have to start partnerships like marriages, and discussing divorce. And I know that sounds cynical, but it is the reality. So a collective can be a great way to share costs, to bring in different types of providers, but you really want to outline like responsibilities, costs. How do we prevent resentment? Like if someone's doing more than the other people, like there are lots of things that could go awry, but it's certainly not a bad option.
Okay. All right. Um, Evan is saying that they pay their W-2 counselors between $60 and $90 a session, depending on volume, and they have retirement, health, and continuing education benefits. But that Evan constantly encounters the challenge of employees thinking that they can make more or keep more if they go out on their own. And then they leave with their full caseload that the company built. How do you navigate those conversations?
I it all starts in your hiring process. So that all starts in like having conversations very early on in hiring and discussing like what's included, why the costs are the costs, why the payments are the payments, and really trying to ensure that you are really walking through that with people. And I also want to know like, are the people I'm interviewing entrepreneurial? Do you have an interest in starting your own practice? Why group practice over private practice? Those are questions that you can ask in your interview process. So I don't have a non-compete. I never will. I don't believe in them. So we do have employee contracts, right? Like somebody signs a contract, a job offer, etc. At the end of the day, there are going to be people who think they're going to make more money on their own, and some of them are going to be right, and some of them are not. So I just don't have a lot of concern for it because I don't think there's anything that we can do to prevent that.
Okay, that sounds reasonable. All right, so we kind of have some all over the place questions now because they've come in as we've continued chatting.
Sure.
So here, someone would like to know, what do you do for billing? Do you handle that in-house? Is it contracted out? And how do you manage it?
So we do have a billing team. Our billing team is contracted out. We've been using them for about 3 years now. Eventually, we may move to a place where we are doing it in house, but at this point in time, we have a really good team who we really enjoy working with. And it's another situation where during the interview process or during the hiring process, you can say, these are the types of admin support we have built in so that you don't have to do the things that you don't know how to do or don't want to do.
Okay. Um, this is an interesting one. Do you have, I know you were just saying something about, not worrying about non-compete or what have you. But do you have employees sign exclusivity agreements, or can they have a practice or a job outside of your group?
So for full-time staff, we don't have people who work in private practices outside of our group.
Mhm.
Um, I don't care if they do other things by any means. So if they want to do, anything else, by all means, go for it.
Mhm.
But we don't typically have people who work in their own private practices. I've interviewed people who have said, I really want to work here, but I do have my own private practice. And it's just never a good fit because it just feels like, to Evan's point, those people would have a hard time figuring out, where do I send people? How do I determine who goes to which practice? So ultimately, we don't have that in place. And if someone that I interview has their own practice or, wants is has their own practice but also wants to join a group practice, I always just point them in the directions of my coaching or my resources or my practice startup guides and stuff like that, because honestly, that's usually what they're looking for.
Okay. All right. Going back to a little bit earlier in our conversation when you were talking about, really digging in and looking at your numbers in terms of, are you prepared for growth? Is there a percentage needed for a group practice to grow?
I don't think there's a percentage needed for the group practice to grow. I think that you really have to look at your profitability. You just have to make sure that you are making a profit. And ideal world, do you have enough profit to essentially hire someone and get them started for a month or two? Because it's going to take a month or two typically to get someone up and going. So I think it's really important to just make sure that you have enough of a nest egg to protect yourself for a couple of months to potentially put into a caseload for someone. I'm always transparent with people. That's a question your applicants will always ask you. How quickly will I have a caseload? You're never going to be able to guarantee that. What I like to say is typically it takes a little bit less than 30 days to get full. in our practice based on the call volume that we have. There are definitely ways that you can ensure that you get full quicker. You can network in your community. You can do some of the marketing. You can do some of the legwork. So I talked to them about that during the interview process to be really clear that there are two different tracks here in terms of how quickly can we make this happen.
Okay. Okay. Here's a question from Anthony. His admin staff is in office 9 a.m. to 5 p.m. Some of their practitioners work until 9 p.m., which has proven to be problematic from time to time. Do you always have admins available, even if practitioners are seeing patients until 8 or 9 o'clock at night?
No, our admin are done at 4 every day. So everything else that needs to happen in that 4-hour window just waits until the next day.
Okay. All right. I like it. What do you do when insurance companies don't accept counselors that are telehealth only?
Um, Niche down really well, beef up your marketing, beef up your content creation, your SEO, and work on attracting private pay clients,
Hmm.
or sublease office space 1 or 2 days a week where people could be seen that the insurance company is located or in the state that you're in.
Okay, great. And actually, a nice follow-up question to that. Do you have a monthly marketing budget?
Yeah, but ours is bigger. Having 20 clinicians on staff, we have 2 medication managers. So our budget's quite large. I also put most of our profit back into the company. I think that if you have maybe $2,000 a month, that could be a good starting point because you can have an SEO team and a Google Ads team both around that cost. So I think that would be a good marketing budget to start off with or to aim for.
Okay. Now this person is asking how you find most of your new, or I should say, how do your new clients find your practice? Would you say it's through social media platforms and paid ads and such, or has it become now more word of mouth based on the fact that you've been thriving for 3 years?
Yeah, so it's definitely word of mouth and good SEO and web presence. We rank number one in Asheville for the things that we are trying to have people search for. And that's taken a lot of strategy, that's taken a lot of hard work, and a lot of um, putting money into the places that grow your business in the long term. Because SEO strategy and marketing are not short term strategies. You're not going to see the return on investment immediately. But those are the things that we really where we put our money. And then other than that, it's word of mouth. It's my Facebook group and some other sources like that.
Okay. And in terms of your marketing and advertising methods, it sounds like Google Ads has been pretty helpful and good for you. Are there any others that have brought return?
Yeah, I have a content creation course that helps people niche down. I think that's been really helpful for people who really want to go private pay and get a better understanding about their ideal clients because that's important if you're going to attract private pay clients. Good web design, good SEO, um, social media presence, all of that stuff, and it's kind of a combination of all of those things.
Okay. We did have one question from Christina, and she's saying, what are the top things you would contract out for administratively? So it sounds like SEO for sure,
Yeah,
um, billing.
SEO, billing, potentially a VA service if you don't have anyone in house to answer calls and respond to inquiries. Um, Credentialing, if you don't have the time or energy to deal with insurance credentialing, a lot of billers probably will require that now. If you're going to do credentialing with them, they're going to want you to also do billing with them because the credentialing side's not where they make their money. Um, what else? What else? What else? I'd say that's probably the majority of it.
Okay. Okay.
Google Ads, any sort of digital marketing.
All right. Perfect. We still have some questions in the queue, but we are just about at time. I think, though, that most of these questions here have been answered sort of as we've gone along. But if not, I will say that you can find Patrick on All Things Practice. He's got some great coaching programs, and I know you've got one-on-one stuff too, right, Patrick?
So I don't offer one on one anymore just because of my throat
Oh,
situation. But We do have some cool offers coming up. So we have the All Things Private Practice podcast. All of you can listen to it. There's over 100 episodes. We've had Jessica Gulish from Spruce on there.
Mm.
So we have that. That's on all major platforms. That will be in the. I sent the link to you as well.
Yeah.
Then we have the All Things Private Practice Facebook group. You can all join that. It's a free Facebook group full of tons of valuable information and content and engagement. We have a summit coming up in December, the Doubt Yourself, Do It Anyway Summit. We have 32 different speakers. I put that link in the email as well. That's a free summit that you can all access. And then I host entrepreneurial retreats all over the world. We do have openings in Asheville for those of you who want to host and build retreats in January of 2024, and Ireland 2025 both have openings. And I sent those links as well.
Amazing. I love it. Patrick, it is always such a pleasure having you. You are truly a wealth of information, and I always learn a lot. I'm sure everyone who joined us today did too. And just as a reminder, I will be sending out a link to this recording in a couple of hours. I will also include all of that great content that Patrick shared with us, from the job listing to all the great neurodivergent resources, so that you won't miss a thing. And real quick, if anybody wants to join us next month, we are going to be delving a little bit more into Spruce, specifically how to use Spruce for family-based communications. Any providers who work with families are often challenged by, all right, how do we get in touch with, more than one caregiver at a time? How do we associate contacts, et cetera? And Spruce has been really instrumental in helping folks with that. So if you want to join us, I'll have a link to that in the outbound email as well. So keep your eyes peeled. And that wraps us up. Patrick, thank you so much. And thank you everyone for joining us today. It has been a pleasure.
Thank you, Carrie. I appreciate it. Thanks, everyone. All right.